Well, I think it's pretty much safe to say that we're all pretty much over this whole shelter-in-place thing. So I had a chance to talk to Dr. Janet Memark. She's the director of Cobb and Douglas Public Health a little bit ago. And obviously the first two questions are, how long is this going to last and when will the worst be over?
Today's a day where there seemed to be an alarming jump in the numbers on the Department of Public Health tracking website. And remember, we have anticipated this as we've been going along. So we've had some increased testing, right? And so with testing, increased testing means increased positivity rates as well. So so we do have a jump in the numbers. Cobb wasn't as bad, which is great. We are increasing some testing some. They're not as bad, but we definitely are seeing an increase overall. So. But that being said, remember, now we have put our shelter in place, was it March 24th. So now we anticipate that we should have a decline in our overall or a plateauing, let's say, rather than decline, but we should be hitting peak at some point coming up soon. So, because we have put a lot of these measures in place. So I wanted to reassure people, I know it is so hard to stay home, but it's been truly one of the most important things that we've done at this point is to shelter in place and not spread the virus. And so I feel like we haven't really been seeing huge numbers in Cobb and upticks in numbers, but it's kind of been steadily going along. So anticipate that we should be hitting some plateauing at some point soon.
All right, so question number two, this whole shelter in place thing, is it working?
What we're going to see is if you're able to graph out the numbers, and I know that it's kind of difficult with some of the public numbers that are put out because there's a delay. Remember, we had talked about the result delays, and those get kind of put back in to the dates that they originally were tested. And so how you're going to see it is you're going to start seeing that doubling time if you can do those kind of calculations, but you'll see how long it takes for our doubling of cases. So if you go from 2 cases to 4 cases to 8 cases, 16 cases, that doubling should slow down, showing that transmission is a little bit taking longer to transmit. So, but we should use overall, things that we watch are the hospitals, emergency rooms, and ventilator spaces, and they're hanging in there right now. So that's a good sign that we were able, if we had let it just keep going, I think everything would have been off the charts at this point. So the fact that everybody is able to hold on and we're keeping that little star below the healthcare capacity is a really good indicator that we are doing the right thing right now.
So is the shelter in place working, and how will we really know, given the fact that we haven't had a lot of testing done yet?
So it does feel really long that we are doing this. So one of the things that we need to do is we need to be able to show that we are able to keep this plateau going for a while, that we're not having a huge spike in cases somewhere. But it's really important that we get our testing capabilities going. So I know this is probably a question that you all get. I get a lot of questions about that. And we're hearing some very good signs that by the end of next week, early next week, our testing capacity should increase greatly. So at this point, not everyone's going to get tested, but we're going to be able to test more and more people that are at risk or having some symptoms. So that's a really good thing. So this is important because once we get to the point where we feel like cases are decreasing some, then we can look and say, all right, we have a new case and we're able to test, we're able to do the contact investigations, we're able to quarantine the right people and kind of wall off each situation. Right now, when you're not able to test in real time, you can't really do that right now. So that's why testing is important. And then at that point, when we're ready to talk about when we can decrease social distancing, we'll have all the tools in place to be able to catch a new outbreak or a second wave before it starts taking off.
So that begs the question, when can I get a COVID-19 test?
Eventually, this is going to be something like you going to get a flu test. Eventually, we'll be getting to that point, right? Right now, that's not the biggest priority. Right now is really trying to catch the highest risk people and then show quick transmission, right? But later, I'm sure that COVID-19 will be on the panel of other tests like the flu test and adenovirus, stuff like RSV. That'll be included. But right now, you will see some increased capacity. So I know the hospital system is able to greatly increase their capacity capacity. There's the pop-ups like CVS. The academic consortium is working on another avenue to do a lot of testing, and Georgia Department of Public Health is looking to increase their testing vastly in the next week for our health districts. So there's going to be a lot of testing that's coming out really soon, and then pretty soon I think it's going to be a much more easily available test to get.
So even if I get tested for COVID-19 and come up positive, there is no cure, so why bother?
One of the public health mantras that we have is, whenever you do a test, there has to be a reason why you're doing a test. If you do a test and, there's no treatment for it, then it's kind of like, okay, so why do you do the test, right? What's the point? If you do a test, it doesn't mean anything, what's the point? So for the point for us here is to be able to find clusters, right? Because we don't quite have any sort of treatment yet. So if we can stop somebody from transmitting quickly, that's what the point is right now. And then eventually we'll have some treatment.
And of course, one big question a lot of folks have had, what about masks? Should we be wearing them, and if so, why?
It's been out there a while now, suspected that there's been asymptomatic spread of COVID-19. So asymptomatic means that, before you show symptoms, you're able to spread it. So they think that's 48, 72 hours up to that you could be spreading the disease. And so now the CDC has recommended, they said, listen, okay, is probably, it's not going to be hurtful for people to wear some face coverings to prevent transmission when you don't know you have it, and to protect, a little protection for people who don't want to get it, right? And so what they're recommending is face coverings. Now, here's the issue. Once again, is there's not enough for our healthcare providers. So we have to save the surgical masks and the N95s for them. They are going into a war zone every day and working with COVID-19 positive patients that are breathing in their faces. So please, when you're going to need a healthcare worker, we got to make sure that they are equipped to take care of us. The rest of us, including myself, who does not see patients actively right now, I have a cloth mask if I'm going to be walking around that I wear, and we made them at home, and there's a lot of homemade recipes to do that. You can wear those kind of masks, and there's a lot of different ways that you can make those. But now it's recommended. Now it's a voluntary thing only, so you're not going to be forced to do it, because some people can feel very claustrophobic. Continue to wash your hands and hand sanitize the best that you can, but it's okay now for if you can wear a mask when you go outside, then that is a recommendation.
We don't want to wear the medical mask, so what about these homemade masks I see out there?
Depending on how you make the mask, it's probably less effective to protect you from somebody that might be, spreading it to you, but it does, if you might have symptoms, because you can get it from talking, or you can spray it from talking and from singing, coughing, sneezing, any of those things. But it gives a little bit more protection for people who are spraying it out versus inhaling it in. That being said, there are several studies, and my daughter and I did a lot of research this weekend looking at different methods. And so, if you have a different kind of fabric, we were able to put a little bit of flannel in between as a filter, and so these things actually help a little bit. So the regular just one single t-shirt is probably not as helpful, but if you look, there are several studies that are showing what the most effective barrier is, and so you can play with that and make one that's most comfortable for you.
Thanks to Dr. Memark for sitting down with us for a few minutes. Remember, if you have any questions, feel free to pass them on to us at information@cobbcounty.org. We'll try to get them answered for you, because obviously it looks like this situation's going to be going on for a while.